Hi, everybody. My name is Brian Didier. I am a third year family medicine resident here at KSB, and I'm here this evening to talk to you about hypertension, otherwise known as high blood pressure. First, we're just going to go over what is hypertension, and then why is high blood pressure a silent killer? Are you at risk for high blood pressure? And then, how can we lower our blood pressure? So, first, what is high blood pressure? Hypertension is the medical term for high blood pressure. It is one of the most common chronic diseases in the United States and affects about 45% of adults 18 and over. And for adults 60 and over, it's about 60% of the population. You may have had your blood pressure taken before, and you might know that there's two numbers to it. There's the top number, which is the systolic number, and that is the pressure on the walls of our arteries when the heart contracts and pumps blood out into our body. The bottom number is the diastolic number, and that is the pressure when the heart relaxes. So we have two numbers that we kind of use for our blood pressure. And on the screen, you can see the different levels of high blood pressure and what's a normal pressure. So normal is generally 120 over 80, and elevated is kind of anything above that. We don't really call it hypertension until it's at least 130 over 80 or 90. And then high blood pressure, where we really want to start treating it, would be 140 over 90. And then if you do have a really high blood pressure, generally over 180 or higher than 120 on the bottom number, that we consider a hypertensive crisis. And that generally requires a little bit more acute management, and possibly, if you're having symptoms, to even have to go to the emergency department. So, why is high blood pressure known as a silent killer? And the reason is because high blood pressure and hypertension doesn't really cause any symptoms. So, for the most part, people don't know if they have it or not. And high blood pressure develops really slowly over time, generally over the course of months to years. But if you do have symptoms, it's likely due to hypertensive crisis, like we talked before. And that's when you might want to seek out medical attention. Or if you are at your doctor's office, they might end up sending you to the emergency department. High blood pressure causes numerous different other chronic diseases or acute diseases as well. Most common ones is stroke, vision loss, heart failure, heart attacks, kidney disease or failure, and even sexual dysfunction. High blood pressure exerts a lot of energy or force on the walls of our arteries, which over time slowly creates really microscopic levels of damage. And that damage causes plaque buildup in those arteries, and it reduces the amount of blood that can flow through the arteries. Sometimes those plaque buildup can become big enough to completely block the artery, and sometimes those plaque buildup ends up breaking off and they go downstream somewhere and end up blocking an artery as well. That's typically how we get strokes and heart attacks. Also, when your heart has to pump against a very high pressure in the arteries, it has to build up more muscle tissue. And to do so, it ends up not being able to fill up with blood as well, and isn't very effective at pumping blood out of the heart. And that's what we call heart failure. Similar with kidney disease, similar to heart attacks, where those microscopic changes over time reduce how much blood flow is going to the kidney. And sexual dysfunction as well, it can cause erectile dysfunction in men and decreased libido in women as well. One thing I wanted to talk about today too is metabolic syndrome. High blood pressure is one part of metabolic syndrome. Metabolic syndrome is basically just a group of risk factors that have been identified that are very significantly increase the risk for heart disease, diabetes, stroke, many other health problems. And a lot of these health problems are what end up leading to low health quality, especially later on as we age. And so it's important to keep these things in mind. So metabolic syndrome includes high blood sugars, low levels of HDL, which is the good cholesterol, high levels of triglyceride, large waist circumference, and high blood pressure. And three or more of these risk factors means that you have metabolic syndrome. And it's very important to recognize if you might have this, because it puts you at a lot higher increased risk for other chronic illnesses and even potentially death. So are you at risk for high blood pressure? The most common risk factors that we see are alcohol use, smoking, other drug use, a sedentary lifestyle, a high sodium diet, a strong family history of high blood pressure or heart disease, stress, and obesity. I'm sure many of us have a lot of stress, and included with all those other risk factors, that puts us at a high chance of developing high blood pressure. The only way to know if we have high blood pressure or not is to get our blood pressure taken. This should happen every time you go to the doctor's office, but if you're otherwise healthy, you might not be going to the doctor very much. And so you might benefit from checking your blood pressure maybe once or twice a week or so at home and keeping a little journal or a log of those blood pressures and keeping track of them and seeing and making sure that they're staying in that 120 over 80 range. If you do notice that you're having higher blood pressures, then we would recommend reaching out to your primary care provider and seeing if you can get an appointment with them to discuss treatment for high blood pressure. So, lastly, how can we lower our blood pressure? Well, there's a lot of different ways we can do that and different changes we can make in our lifestyle that can help promote a healthier lifestyle and lower blood pressure. The first one is diet, and then there's limiting smoking and alcohol use, enjoying regular physical activity, managing our stress appropriately, trying to maintain a healthy weight, and if we need to, taking medications. The most important parts of those I kind of highlighted on the right side of the slide there. The first one is diet. Diet plays a huge role in our blood pressure, particularly how much sodium we take in, how much salt we take in. And in a lot of foods that are easy to eat these days that are processed or canned contain high amounts of sodium to help make them taste better. Unfortunately, this also increases our blood pressure. There is something called the DASH diet, which focuses on reducing sodium, red meats, and adding in healthier foods like greens. But one of the most important things to trying to fix our diet is really changing about how we think about food, how we think about grocery shopping, how we think about portion sizes. And so learning all those things and trying to limit our portion sizes, trying to focus when we go to the grocery store, staying on the outsides of the grocery store where the healthier foods are, and avoiding the chips and the canned foods and the processed foods and some of the frozen foods too. The next thing is physical activity. This has been shown to be the most important aspect of our lifestyle that we can change that can help make us healthier. Not just for lowering our blood pressure, but for preventing metabolic syndrome, for preventing dementia, and for just overall increasing our own quality of life. Especially as we age and get older, we tend to lose our mobility and our ability to do the things that we want to do. Um, we recommend at least 150 minutes per week of moderate intensity exercise. And I like to describe moderate intensity exercise as if you're able to do the exercise and hold a full conversation, you're probably not working hard enough. However, if you're doing your exercise and you're only able to string together a couple words at a time, you're probably doing a little too high intensity of exercise. And so it's important to try and find that middle ground that raises our heart rate, but not to the point where we're overdoing it. It's very difficult to get started doing physical activity because we tend to think that we need to run or we need to lift weights or just do one specific thing. But most importantly, it's best to diversify your workouts. So that could mean include running or walking, jogging, biking, doing some kind of aerobic exercise a couple of days a week. Then maybe a couple other days of the week doing strength workout, mobility, yoga, stretching, all those kinds of things. And it's just important to find something that you enjoy doing. Otherwise, it's going to be really hard to stick with it. Some of those things might include local recreational leagues or sports teams to join, fitness classes, dance classes, or just getting a friend and figuring out something that you both enjoy doing, such as tennis or other sports. And getting outside and being able to exercise is going to really help your blood pressure, but also your overall quality of life. And then lastly, some people, even if they have a good diet, good physical activity, sometimes some people are just genetically predisposed to having high blood pressure. And so that's when we really would consider medications. There's several risk factors we can't change, such as our age, our gender, our race, that can all might be a risk factor for increasing our blood pressure. And so that's when your doctor would talk to you about medications. There's numerous different medications we can use to help lower our blood pressure, and finding the right one that works best for you might take some trial and error. It's also important to be honest and open with your provider about not only your lifestyle, but medication use as well. Sometimes we forget to take our medications. I do the same thing. And if you might skip a couple days a week and your provider doesn't know that, you might have a slightly higher blood pressure when you go to see them. And because of that, they may end up wanting to add on another medication or increase the dose. And, we as providers always know that people don't like taking medications. We don't like taking medications either. But it's really what is end up being the best thing for us. And if we can limit how many medications you're on, that would be ideal for everybody. All right. Well, thank you everybody for taking the time to listen to me today. A couple of the key takeaways to remember: hypertension is just the medical term for high blood pressure. Our goal blood pressure is generally less than 140 over 90. For some people, that may differ, and your provider or healthcare provider will let you know. It's important to remember that hypertension increases our risk for heart disease, numerous other health issues that really can lower our quality of life and potentially even lead to death. And the best way we can lower our blood pressure is through changing our lifestyle habits, especially diet and exercise, but also, again, trying to reduce our alcohol and smoking intake. And then again, for some people, we do end up needing to use medications to help lower the blood pressure. Don't forget to be honest and open with your doctor, have a conversation with them, and figure out what's going to be best for you. Thank you, everybody.